millions and millions of people have their quality of life reduced by the presence of dry eyes. People will come in and they say, you know, my eyes are always watering, and I go outside, my eyes start watering uncontrollably. And I, or their eye doctor, will say, your condition is called dry eye. And they'll say, what do you mean? I just told you my eyes are wet. In patients who have dry eye syndrome or dysfunctional tears, the protective element of the tears called mucin is not produced in the sufficient quantities. But a big part of developing dry eye syndrome is a history of long-term use of soft contact lenses. Soft contact lens wear over the years is just generally very safe, but one thing it does do, it reduces the sensitivity of our eye neurologically. So our eyes don't always have the proper signal going to the glands to secrete more tears to keep them well lubricated. Everybody's got air conditioning in their car, and the air conditioning or the heating in the winter, the air conditioning in the summer blows right toward your eyes, causing the eye to dry out. And this causes people to drop off of contact lens wear. Perhaps up to 70% of contact lens wearers between 35 and 50 will actually at some point stop wearing their contacts due to increasing discomfort. That's dry eye. Today, the treatments are evolving. We have a prescription medication called Restasis, which stimulates the eye to actually produce more protective tears. There are fish oil and flaxseed oil supplements which regulate the composition of the tears. What scares patients the most, it's macular degeneration. The macula is an area of the eye in the retina which is most densely packed with cones, and it is the most important area for maintaining good vision. It's got the tightest and most dense supply of the cells that are important for us to be able to see. As we age, some patients develop a deterioration in which the blood vessels leak fluid or blood, and the circulatory system in that area becomes diseased and damaged and less able to supply the nutrients that area needs. That area then deteriorates, and it's called macular degeneration. This is not like glaucoma. This is not a condition where you think your vision's fine and it isn't. This is an area where the patients come in and they are having vision problems, anywhere from mild to severe. What are the risk factors for regular age-related macular degeneration other than related to diabetes? Well, number one would be family history. If you have a parent or a sibling that has developed it, you have a greater likelihood of getting it. But you can't control your heredity. What you can't control is the number two risk factor. That's smoking. A history of smoking gives you a very, very significantly elevated risk. The main thing I tell people is spinach is very important. Spinach has a phytonutrient called lutein, L-U-T-E-I-N. Lutein is extremely important in reducing the risk of macular degeneration. And the most likely source of lutein we have in a diet is spinach, which can be either raw or cooked. It does not seem to matter. Other good sources of lutein are broccoli and kale, K-A-L-E. One thing which is overplayed, overblown, and actually can be dangerous if you have too much is carrots. Don't overdo the carrots. Carrots are virtually not needed for your eye unless you're close to malnutrition.